Module 10. Clinical Trials. Objectives. Describe the reasons why patients participate in clinical trials. Describe the opportunities for patients in Phase 1 clinical trials. Discuss Phase 1 clinical trials with patients and families using a 7-step protocol. Low participation rate in clinical trials. Too few trials. Restrictive eligibility criteria. Physicians don't do offer trials. Patients refuse participation. Why patients enroll in trials. Hope for response. Recognize small chance for benefit. Patients as fighters. Realistic not nihilistic. Palliative care or Phase I trial. Most Phase I consents offer palliative care as alternative treatment. Patients aware of choices. Phase I plus palliative care. Change in risks. New agents may have less toxicity. Opportunities in clinical trials. Offer clinical trials. Identify fighters. Honest presentation of Phase I trials. Phase I and symptom management. Informed consent. Nature of the trial. What it will involve for the patient. Risks. Common. Rare but consequential. Ensure patient insight and rational reasoning. Research on palliative interventions. Which patients should be enrolled. Refractory symptoms. Prior intolerable side effects. Substitute/supplement conventional options. Conflicts of interest. Clinician role trumps investigator role. Incentives. Financial. Career advancement. Research progress versus patient best interest. Tell the patient your role in the trial, if any. Discussing Phase I trials. 7-step protocol. Set the stage. Determine what the patient/family knows. How much does the patient want to know? Enough for informed consent. 7-step protocol. Discuss the patient situation and the potential clinical trial. Informed consent discussion if applicable. Respond to emotions. Plan next steps and follow up. Review and revise periodically. Step 1. Set the stage. Plan what you will say. Familiarize yourself with the patient. Diagnosis, prognosis, treatment experience, the protocol. Determine who else should be present. Step 2. Determine what the patient/family knows. Knowledge of disease status. Treatment expectations. Phase I trials. Step 3. How much does the patient want to know? Identify patient preferences for information. Knowing the truth. Will the patient information preferences allow for informed consent? Step 4. Discuss the patient situation. Clinical trial. Straightforward presentation. Avoid jargon. Check for understanding. Encourage questions. Review consent. Step 5. Respond to emotions. Are you using me as a guinea pig? I'm going to go through all of this for nothing. I'm going to give up all my good time. Step 6. Plan next steps. Follow up. Plan for next steps. Reassure the patient. Step 7. Review and revise periodically. Reassess. Understanding. Goals of care. Comfort to continue participation in the clinical trial. Summary. Limited clinical trial enrollment. The fighter. As participant. Phase I plus symptom management. Informed consent. Managing conflicts of interest. Spikes plus structure for communication.